There's a lot of ways to kind of tap into our knowledge about what we know we can do for that patient and put some of that together.
Welcome to the LearnSkin podcast with me, Dr. Raja.
And me, Dr. Hadar, where we discuss all things skin.
Join us as we delve into the art and science of skin health in today's episode.
Hey, Raja, can you say the thing I told you to tell them?
Of course. We are board-certified dermatologists. This podcast is meant for educational and informational purposes only and is not considered medical advice, nor does it serve as a substitute for professional care by a doctor or other qualified medical professional. All opinions shared do not express the views of Learn Health, Inc. Let's get to the good stuff.
Hey, Raja, how are you today?
Hey, Hadar, I'm feeling like in a real personalized mood today. What do you think about compounding pharmacies?
Oh man, I love this. That's one of the advantages we have as dermatologists. And as physicians, we kind of know how to make these little cocktails together. And, I always tell my residents that when you graduate, there's two things or two people that you want to have a close relationship with. One is your dermatopathologist. And right behind that person is your compounding pharmacist waiting there to help save the day.
Yeah, there's no question about it. It's one thing to dream up a formulation. You and I both had a mentor that said this. Ideas are a dime a dozen, but how do you put it into practice? Find yourself a compounding pharmacist. And we went and found one. So we have Peter Koshland, who is a graduate of Georgetown University and UC San Francisco School of Pharmacy. And he owns the compounding pharmacy, Koshland Pharmacy. And he's been working in the Bay Area, San Francisco, since 2009. Peter, we are super excited to have you on and talk bioidentical hormones with you today.
Yay. You guys are now my two favorite people for what you just said about compounding pharmacy. So it's awesome.
Yes, absolutely. Absolutely. And perhaps we should start with the beginning and talk about you for a minute, because you went to a pharmacy school and you had the opportunity to open your own business. What made you think about compounding as a niche or as an area that you want to focus on?
Yeah, it's a good question. We don't learn this stuff in pharmacy school, and I think a lot of people learn about a lot of what they know in their professional career after they graduate from school, and that was certainly the case with me. And I really discovered it 5 or 6 years into my career and just absolutely fell in love with it. I think I'm a creative person by nature, so I love the creativity. And I love the idea of being a clinician in a retail setting, which is something that pharmacists have kind of been stripped away from. But with compounding, we get a chance to work closely with people like you and kind of get creative and come up with these great formulations. And at the end of the day, we just get great outcomes from people because we can customize. So we can be very closely connected to the patient and doctor and, come up with stuff that we know is going to be very tailored to them. And if for some reason it's not working, we kind of go back to the drawing board and keep working at it until we get the outcomes we want. So as a professionally, that's very gratifying too, because I know most of us go into medicine because we want to help people and help people get well and get better. And we have, a really good track record with that as compounders. So it all kind of fit for me. Everything that I wanted out of healthcare career kind of all fell into place with compounding for me.
Yeah, absolutely. And I think that it's really great to have a great compounding pharmacist sort of at your side, because I find that the pharmacist I work with develop a relationship. I talk to them. I ask, hey, what other people are using and what's hot nowadays? And you kind of learn and evolve as a practitioner, which I think is cool. And even though we're going to focus a little bit in a minute about bioidentical hormones, I think for those dermatologists and other practitioners out there who are not using a compounding pharmacist, you should know that it's more than just that. There's many, many different formulations that you can compound together and work with your pharmacist to find sort of the sweet spot and things that you like. And it's really sort of one of the fun part of our practice.
I have a question for you, Peter. I mean, maybe this will be a really important thing just for laying the groundwork. Can you talk about how the licensing works for compounding pharmacies? Can you send prescriptions anywhere in the country, or do you have limitations? How does that work?
So any pharmacy, if we're going to ship something, it has to be shipped into a state that you're licensed in. So I have to be licensed into the destination state of a shipment. So for us, we're in California. We're based out of San Francisco. So we're only licensed in California. So we only service patients within this state. Some pharmacies choose to get additional licenses so they can expand into other states, but that is a limitation. And pharmacy is kind of regulated, kind of like medicine, on a state-by-state basis. And each state has its own rules and regulations. So, for us, we stick to California, and that's just a decision for our business. So,
fantastic. Well, Peter, we really wanted to delve into this whole topic of bioidentical hormones. And I know there's been a lot of conversation around, how to use it, safety, but can you get us started on what are bioidentical hormones and, how do we put that into context with hormones that we have naturally in the body? Is it the same thing or are they different?
Yeah, so it's a great question. And the word bioidentical has different connotations depending on who you're talking to. And generally, we actually just call it hormone replacement now because for some people, the word bioidentical is not a legitimate medical term, although what the term's really referring to is the nature of the hormone that you're giving. So by definition, a bioidentical hormone is just basically structurally identical to the human hormone. And what makes that significant is that for many, many years, and still to this day, we're giving people hormones that are not identical to the human hormones that our body makes. And especially on the progestin side, instead of giving people progesterone, we're giving things like medroxyprogesterone or norethindrone, progestins that have progesterone-like activity, but structurally they're quite different. And the reason this is an important distinction really goes back to the WHI Women's Health Initiative, which was you're around practicing around 2002. You couldn't avoid this trial because it was halted before it was completed. And it was studying Premarin, which is an estrogen product, and a synthetic progestin called medroxyprogesterone. And it was halted because the patients who were getting the treatment were having much worse outcomes than the patients on placebo. It was a huge trial. They had two main pieces of it. One was with both of those drugs with over 16,000 patients. And they had another trial in women with hysterectomies who had just got the estrogen component. And for the combo treatment, the outcomes for the treatment were much worse in terms of Alzheimer's disease, clotting, all-cause mortality, pretty much across the board with a couple of minor exceptions around bone density and things. People did much worse on the treatment, and therefore it led to this conclusion, I think wrongly by much of the media and the mainstream, that hormones were dangerous and they caused problems. And what we really wanted to do was kind of make the conversation a little bit more refined and say, these hormones cause problems. Yes, absolutely, 100%, undeniably. But the structure of the chemical and the hormone that we're giving the patient really, really matters. And because it's not identical to what the human body makes, it's having all these untoward events because it's not hitting the receptors very precisely. It doesn't have precise metabolism. And these little changes make a big difference in the body. So that word bioidentical kind of came along to differentiate these hormones from the ones that were in some of these trials that had all these adverse outcomes. And when you look at the research on the bioidentical hormones or the human hormones, it's a totally different story. And that's a story we're trying to continue to tell so that we can kind of get past what we consider to be the dark ages in hormone replacement, where everyone's just afraid of hormones. They think they're dangerous. They have all these problems where actually these bioidentical hormones have a very different profile and probably a lot of benefits that we're ignoring, and we're kind of expanding and maybe amplifying unnecessarily the risks.
Well, Peter, I think the really important point that you made in there is when you said hormone replacement therapy, I immediately thought of that study. And I feel like, a lot of us in medical school have been taught like hormone replacement has these issues. So can you talk about how are the hormones that are available to be used, especially you as a pharmacist, what is the breadth of hormones that are out there and which ones do you find yourself working with practitioners with most often? I'm guessing it's not Premarin.
It's not Premarin. No, it's not Premarin. And it's still out there, but again, I think based on the research that's out there and based on, I think, some common sense and some understanding of physiology, the thought process around a bioidentical approach is, we only want to give hormones that the body has made itself precisely that chemical structure, because it has that precise receptor, lock and key fit, it has precise metabolism, and we know physiologic amounts that the body can handle because we know what the body produces, during, for a woman during their cycle, et cetera. So those are the hormones we primarily work with. And there's several that are kind of the top, I'd say the top four. I mentioned progesterone, which is extremely important. We have estradiol, which is the main estrogen. We have estriol, which is an alternative estrogen that's usually and oftentimes dosed with estradiol in combination. And that really helps with things like vaginal dryness and urogenital symptoms. It also is the one for skin. It has wonderful effects on the skin. So for the dermatologist, this is a really good one to know because it helps with collagen and elastin synthesis and hydration of the skin. And then there's testosterone, which we're talking about women here. Actually, there can be testosterone deficiencies that cause some symptoms. So we kind of look at those, and our goal is really to restore kind of a physiologic level, looking at symptoms, making sure we're relieving symptoms, and then looking at all the hormones kind of in concert with each other. So we're not focused just on the estrogens or just on one thing. We want to make sure that they're working together because the systems are complex and they have a lot of interplay. So we can't be too narrowly focused. We want to look at the breadth of their profile and then make sure that the way that they work together is optimal.
I really like that you mentioned that, because when we think about integrative approaches, we always think more holistically in all the systems that are involved. So this definitely rings a great bell for me when talking about treating a patient as a whole. You mentioned some uses in dermatology and topical application, and I'm wondering if you can go over some of the special considerations that we have to keep in mind when we use these medications topically.
If you're using just for skin, estriol is a wonderful option. And what makes it really nice is it's really kind of has very minimal effect outside of dermal tissue. So we don't have to worry about unopposed estrogen or something like that, where maybe we're worried about endometrial overproliferation. It doesn't have increased clotting effects or any of these other kind of things that we associate with some of the more powerful estrogens like estradiol. So that's a really wonderful estrogen that can be used in and of itself in dermal applications as a skin cream. And we do that all the time and have very good outcomes with that. I have actually some very good photographic evidence of people responding really well to a formulation like that. The thing with estriol, though, is it's not really going to address some of the systemic symptoms a patient might have, like some of the night sweats or hot flashes or brain fog. That's really where the estradiol comes in. And that is a much more powerful systemic estrogen. And that has to be balanced out with appropriate progesterone to prevent endometrial overproliferation or any increased risk of endometrial cancer. We want to make sure that the doses are adequate so that we're not increasing the risk of any other potential side effects from that hormone. So if we're just looking at skin, estriol is a wonderful kind of one-stop shop. It's very easy to prescribe. We usually do like a 0.3% cream. And that's just in and of itself is a great formulation. If we wanted to kind of address more of the systemic symptoms, then we have to kind of go in and kind of look a little bit more broadly about making sure we're doing things very carefully.
And, this is a great opportunity to take a quick break and tell everybody who are listening, if you're already curious about working with a compounding pharmacist, or you're curious about their specific formulations, we'll have Peter with us in Sacramento this coming October at the Integrative Dermatology Symposium. He'll give a great workshop, try to open your horizons and try to learn more, not just about the specifics of, for example, bioidentical hormones, but just in principle. How do you work with a compounding pharmacist and how you can improve your practice every day? So I wanted to mention that before we forget and move on, and which actually leads me kind of naturally to my question, which is, we have a lot of practitioners listening to this, and maybe you can advise them how is the best way for them to work with a compounding pharmacy of their choice when they're talking specifically about bioidentical hormones.
Yeah, it's a great question. And it goes back to your earlier statement at the very beginning, which is establishing a relationship with a compounding pharmacist is just a great practice builder, because you're just going to add on the expertise of that pharmacist into your practice. And we see ourselves as, one of the big jobs I have is a consultant and somebody who talks to doctors about specific cases and, helps formulate stuff for, whether it's a difficult to treat patient or somebody who needs something that's off label or based on some research that hasn't found its way into a commercially available product. That's kind of what we do. So it's really fun for us to work like that with doctors, because it's, we get to be creative and come up with these interesting solutions. So it's a different relationship. It's something we kind of have struggled with over the years, is how do we kind of help, especially patients, but doctors too, understand that, it's not just sending the script to the pharmacy when it's a compounding pharmacy. It's really like adding another element to your care team that can help you add that pharmaceutical expertise to your team and be a resource for you. So having that relationship, I know, Raja, you and I have talked, 100 times now,
I think it's getting up close to 1,000 soon.
And I think that's kind of something that, is different than probably your relationship with the pharmacist at CVS or Walgreens, but it can be really rewarding. So kind of, I love to give tours of my pharmacy, so if a doctor says, hey, I'm interested in kind of checking you guys out, can I come have a tour? Well, in COVID times, that was hard, but now things are opening back up. And that's a great way to kind of check a place out, look at how things are made. You want to evaluate the quality assurance too, because, there can be really big variables in the quality of compounds from one lab to the next. So you want to make sure that they have checked all the boxes in terms of testing their finished products and acquiring really high quality chemicals and bases for their compounds for your patients. Yeah, it's something to kind of consider and go out there and make that relationship with somebody, either, with us, work with doctors all over the state of California, but maybe there's somebody local to you that, you want to get to know. They probably want to get to know you too. So it's a great opportunity.
Peter, I have to say, I've learned a lot just from working with you in terms of formulations. And if you don't mind going back to that just for a second, say we come to you and as any practitioner going to a compounding pharmacist is saying, oh, I want to do, 0.1% of this, or you had just mentioned, S-trial as an example. What are the options that you think through when it comes to formulations? I know you and I have had many conversations about this, and there seems to be so much customizability there. How do you think through a formulation, and where do you begin with that? And how can a doctor help you make the formulation that we really want?
Yeah, it's a great question. And I think it really depends on the patient's condition and what's guiding us. I know you bring a lot of interesting research to the table, and we're looking at, maybe in some of these small trials that we're trying to, emulate, we're looking at like what types of formulations they use in that trial. And then maybe also, I always say that you don't want to ever underestimate your knowledge of physiology and anatomy in some of these decisions. So, when we think of something like as simple as acne, and we think about the inflammatory process that's going on with that condition, I think of something like niacinamide, which is a B vitamin, but that we know has really good anti-inflammatory effects in the skin. So, if we're thinking of, some formulations, we're thinking about what the condition is, what some of the pathophysiology is, and then what tools we have in our toolbox to kind of address that underlying disease state. We might consider, starting with some basic research and then kind of maybe adding one or two things that we think will augment that or help with that. Or we just keep it simple and say, let's try this and see if it works. We know where the patient lives. We have a relationship, and we can always go back and make it stronger, add some things. How you finally get to that final, prescription, I think it is that conversation, and hopefully the pharmacist can guide you and let you know what you can and can't do. I mean, you can only put so much stuff in a cream. Once you get to about 25%, you start to saturate a lot of creams. But there's a lot of ways to kind of tap into our knowledge about what we know we can do for that patient and, put some of that together. So,
Peter, on that note, because I used to do a lot of transdermal drug delivery research, and can you talk about the role of the vehicle in driving stuff in versus just pure percent of the actual active? 1% is better than 0.5%, but doesn't the vehicle make a difference too?
Absolutely. And it really depends on what you're trying to treat. If you're trying to treat something in the epidermis, you may not have to worry so much about driving the drug deep into the deep recesses of the skin or even into the systemic bloodstream. It also depends on the polarity, the size of the molecule, and the potency of the drug. So we have different tools for like taking polar molecules and kind of putting them in like a lipophilic sheath to allow them to absorb through the stratum corneum and not be blocked by the outer layers of the skin. So a lot of those considerations come in, and a good compounding pharmacist should be pretty well versed in the different options, whether you want to create something that's truly transdermal and drive that ingredient, that active ingredient, deep into the skin or systemically into the tissue, or maybe when we want something a little more shallow that's going to work more at the higher levels of the skin. So, but yeah, absolutely, the base has a huge impact on that, and it's an interplay between the base and the active drug too. So how they work together can be part of that decision as well.
And I think these conversations are what makes it so much fun. I know that actually I have patients it happened to me a few times already, that patients came to me and said, I read about this medication and that medication, and you find it very difficult to find anything on the market. And so you call your compounding pharmacist and say, hey, how can we do this? And you work together to come up with a safe formulation that is efficacious. And the patients are just so excited and happy to get this personalized care, actually. And also, I find that every now and then there are medications that are on the market that patients cannot reach because of limitations of cost and access to care. And so a compounding pharmacist can help you to say, okay, look, here's an alternative to this, and here's what we can do, and make this somewhat affordable to the patient, and so increase access by doing that, which I think is an important role that often is being forgotten. We always think of compounding pharmacists to kind of give us that stuff that will, focuses maybe more on aesthetics, but just the run-of-the-mill stuff can actually save patients a lot of headaches and cost.
Thanks for bringing that up. We just had a patient that had leishmaniasis and on a trip to South America and came back and had leishmaniasis, and we were trying to get either some sort of, we didn't really want to do the antimonial infusions, but we were thinking, hey, maybe we should get some, one of these exotic medications. But, cut to the chase, our local compounding pharmacist was able to make a cream that was reasonable and not inaccessible. It was expensive, but the child's mother got it. And I just saw this child yesterday, had been struggling for a year with this draining lesions on the face, clear for the first time. And I really have to thank the compounding pharmacist, went out of their way to just make it happen. So I totally agree with you, Hadar. It gives you access to stuff that we want access to anyway, not just exotic stuff.
Yes, absolutely. And I think on that note, if you like what you heard and you want to hear more, I want to remind you again, come listen to Peter give his workshop at the IDS this coming October in Sacramento. There's so much more to be learned. And I feel that, like we mentioned, it's an evolving relationship. So if you don't have one going, come to the IDS. Peter will get it going for you, either with him personally or with many others around the country, other pharmacists who are so eager to help and collaborate. Peter, I want to thank you for joining us on this podcast, and thank you for your time, for your expertise. I know personally, I'm going to run to your workshop. I'm looking forward to it.
This is fun. Great to chat with you guys.
Hey, Raja, what are you doing this October 22nd through the 24th?
There's only one right answer to that question: the 4th Annual Integrative Dermatology Symposium.
Of course. Now, a question. Are you going to travel all the way to Sacramento, California to meet me in person, or are you going to join virtually in your pajamas?
Pajamas in person? Well, you might see me in pajamas at the Sheraton Grand in person in Sacramento, or maybe I'll be in a Jolly Folly costume. Who knows? But I'm excited to chair this hybrid, one-of-a-kind conference with you, Hadar.
Well, man, I do love this unique event our team just put together. This is an event that really takes an integrative approach to common patient questions, also an integrative approach to challenging dermatology diseases. We also are going to cover aesthetics and have practical takeaways to start using in the clinic right away, just when you come back. So, this is the kind of information I just can't find with any other meeting.
So true. And the good news is it's not just for us. It's for practitioners of all backgrounds, and everyone is welcome. Use our discount code IDS25 at checkout for 25% off registration. And you can find us at www.integrativedermatologysymposium.com. Come say hi and tag us on social if you'll be there. And our tag is @IntegrativeDermSymposium.
We hope to see you there.